Okay, good afternoon, everyone. I think we will start and then Jeff can allow some other people who enter in a bit. Good afternoon, everyone. This is Salma Zahid, your Member of Parliament, and Happy New Year to all of you. We are already almost 1 month past and 2021. I hope this year will be a great year for everyone as we see some light at the end of the tunnel with the development of the vaccine. Uh, because of the stay home orders in Ontario and based on the public health advice, my constituency office, the community office, is closed, but myself and my team are there to help you. So if you need any help in regards to the federal issues or need some information on the programs which are available, please get in touch with us through either email or phone call. If you call the constituency office, you can leave a voicemail and then one of the staff members will get back to you. So please, if you have any questions or if you need any help with any federal issues, please email it to us at salma.zaid@pal.gc.ca, or please call us at 416-752-2358 and leave a voicemail. So someone from my team will be in touch with you. We are working virtually. I am also working from home. The parliament is coming for the 2021 session. It is starting on Monday, and we are trying to do it virtual more or less. Like, I think other than the Ottawa members right now, no one else will be probably going to the chambers. We are all working from our constituencies. So it is really very important that we follow the public health advice and go through that. So as we always get some opportunities to host some meet and greets, because we cannot meet in person. So I thought we will do a virtual meet and greet and see how everyone is doing and what questions you have on your mind. Today, I am also joined, and we have invited a very special guest to be part of this town hall to answer some of your questions. So we have David Belous. He's the Chief Strategic Partnerships, Public Engagement and Government Relations at Scarborough Health Network. So I will be formally introducing him after the O Canada, but he's here today and he will be providing remarks, and then we will provide you an opportunity if you have any questions to ask him. So we will start today's meet and greet with singing of O Canada, and after that, I will give some update from on behalf of the federal government about the programs and the where we are in regards to vaccine. After that, we will provide David the opportunity to give some introductory remarks, and then we will go into questions. Some individuals have already submitted questions, so we will start with the questions which we have already received, and then based on the time, we will go into the questions from the participants. And in the end, we will show you some pictures, a collage, what year 2020 has been. So we will start with O Canada. We have a group from Skyway Bible Assembly, one of the local church in our riding, and their team will be singing O Canada for us. So Nestor, if you can please run that. Thank you, the team from Skyway Bible Assembly. Thanks, Bill. I see the Pastor Bill also joining our town hall. Thanks, Bill. And on behalf of myself and my team and everyone joining us today, please convey a big thank you to your team. Um, so I will start with some update on the programs which the federal government is offering during this pandemic and where we are. As you know, back in March 2020, when we were hit by the first wave of the pandemic, we launched different programs like SERB and wage subsidy for the businesses, loans for the businesses. So those programs, some programs have been changed, and now we have replaced SERB, Canada Emergency Response Benefit, with different numbers of programs. So temporary changes have been made to the employment insurance program to increase the eligibility and benefits. And those people who don't qualify for EI and still have not been able to get back to work, we have created the Canada Recovery Benefit, the Canada Recovery Sickness Benefit, and the Canada Recovery Caregiving Benefit. Uh, so anyone who is not getting EI and they have lost their income because of the pandemic, they can apply for Canada Recovery Benefit. We have also expanded the support for the businesses. As we know, small businesses are going through very tough times, and because of the lockdowns, many had to close their doors. Canada Emergency Wage Subsidy can cover up to 75% of an employee's wages for the qualifying eligible employers, and we have made it very easier to qualify. The new Canada Emergency Rent Subsidy Program can cover up to 65% of the eligible expenses to qualifying businesses, charities, not for profits, and even more if the lockdown is ordered. And the change which we have made to the rent subsidy program is that it doesn't require landlord participation anymore as it was before. We have also a wide range of programs that provide access to capital for many different kinds of businesses, and in some cases, forgivable loans also. So you can learn more about these programs on the website. And if you need if you have any further questions, my team can help you determine if you qualify and access more information. One another big question which is on everyone's mind these days, and I'm hearing a lot from the constituents of our riding also, is about vaccines, because that's the light we all see at the end of the tunnel to get out of this pandemic. We are almost 1 year into this pandemic, and we are very excited that vaccines have been arriving in Canada before Christmas. So two vaccines, Pfizer and Moderna, were approved by Health Canada. Where it's going to take some time for vaccine to be produced and for enough to be delivered to vaccinate everyone. But we have committed that by September, all those Canadians who want to be vaccinated will be vaccinated. We can promise to Canadians that everyone who wants to receive the vaccine will receive it free of charge. We are right now on track to have that happen by September, and that timeline has not changed with the recent production delays with the Pfizer vaccine, which we have been hearing in the last week. And while vaccination is the optional choice of every Canadian, I would strongly urge you to consider reliable data from the reputable sources and make the best decision for your health and that of the loved ones. I hope we all trust Health Canada, and when Health Canada approves a vaccine, we are confident that it is very safe and effective. In regards to myself, when my turn comes, I will line up and get the needle in my arm. Vaccinating Canadians is a team effort, and all levels of government have a very important role to play. The federal government is responsible for procuring vaccine from the manufacturers and delivering it to the provinces and the territories. The provinces decide which groups will be vaccinated when and allocate vaccine to the local public health units, and the local public health units work to get the needles into arms. So as of Thursday, the federal government has distributed over 1.1 million vaccine doses, and out of which The province of Ontario has received 411,650 doses, of which 302,000 are of Pfizer and 109,400 of Moderna. This information is regularly updated and is available publicly at canada.ca/coronavirus. You can get the recent numbers from that website if you need some more information. All of us have been hearing about some temporary delays in delivering of the vaccine Pfizer. This is because that the production plant in Belgium, they are making some manufacturing issues there, and they are suspending the production at the plant of in Belgium. This will mean a temporary slowdown in shipments to all the countries which are being shipped from that plant specifically, and that includes Canada. But we are in constant touch with the company and have been assured the missed shipments will be made up by the end of March. So this is a temporary delay, and we remain on track for our vaccination targets for September. This will not have a long-term impact. It's only a short-term delay. As more vaccines are completed and approved by Health Canada, I expect that the pace will increase. Health Canada is currently examining the AstraZeneca vaccine, and also Johnson and Johnson may soon be ready for the evaluation by the Health Canada. So this is an independent and rigorous scientific process. We must allow it to remain independent and not subject to any political interference. So Health Canada will review it. It is reviewing AstraZeneca and then make a decision. I know we all want to get this done faster. We must remember this is a global pandemic and we all can do to accelerate deliveries. But as I said, coming vaccines don't negate the need for all of us to limit our contacts and bend the curve. That is really very important. We have to follow the public health advice and make sure that we reduce our contact. That's only we can bend the curve. Many questions have been raised about the PPEs and the testing kits also. So I will provide you a brief update on that also. As of now, until now, we have shipped over 14.3 million rapid test kits to the provinces and territories to the date, out of which Ontario has received more than 4.4 million. And now it is up to the provinces to decide how best to deploy the rapid testing kits for their users. We also deployed 354 Red Cross staff are deployed and are currently helping in long-term cares across the country. Federal employees are making up 3,500 contact tracing calls daily to support the provinces, including 360 daily in Ontario. Also, federal government is providing help through the federal labs to increase the provincial lab capacities. We have also committed 100 million for safe voluntary isolation sites across the country. The Toronto site also opened in September. As of Friday, the Government of Canada announced that it will deploy 2 federal mobile health units to Ontario in response to the provincial request. So the federal mobile health units will relieve pressure on the Ontario strained hospital capacity and are expected to go to the Greater Toronto region. I have received a lot of emails and phone calls about the tragedy which is being faced by our seniors in long-term cares. The losses have been heartbreaking, and homes in Scarborough have been hit very hard by this pandemic. I regularly visited the houses in our community before the pandemic, and I've been in touch with the staff to check in if they need anything or anything which can be done from our end. It is really very important to keep in mind that we can and cannot do as a federal government. The provinces are responsible for healthcare, and this includes the regulation and oversight of the long-term cares. We have responded positively to every request we have received, from our provincial governments to provide them the help they need with the armed forces as well as the Red Cross. Uh, in our fall economic statement, we announced $1 billion to provide help to our long term cares across the country. One important issue, which I think the Prime Minister has been highlighting in his recent remarks, and we are trying to tell everyone, is about travel outside the country and even within the provinces. As you all know, that the government has strongly advised against all non-essential travel since we were hit by the first wave of the pandemic. As an additional step, just the first week of January, we have implemented a program to require a negative COVID test to be proven within the last 72 hours of a flight coming back to Canada. And once you travel back to Canada from outside Canada, there's a quarantine act which you have to follow. 14 days of quarantine on arrival remains in place. It has nothing to do with the negative test of the COVID. Everyone coming back to Canada should quarantine themselves for 14 days. Non essential travel should be avoided by all Canadians. This is not a time to do our vacations, go to the resorts in Cancun or Mexico, and this puts everyone in danger. So I think it is really very important. And the Prime Minister recently said that there could be new restrictions to travel and flights that could affect people coming in, possibly in the middle of your trip. So it can make very difficult for you to return home. The Prime Minister said just yesterday that the government is considering requiring a mandatory 14-day quarantine for all people coming back to Canada in a hotel at your own personal expenses. So travel right now is at your own risk. So please, the advice is that avoid that. So with that, this was some of the update which I wanted to provide you, and we have been receiving questions on that. With that, now I will end and I will invite our speaker, David Belous. David is part of Scarborough Health Network, Chief Strategic Partnership and Public Engagement, and as well as Government Relations. And on behalf of everyone here in Scarborough, I want to thank you, David, for all the work which you and your team have been doing at Scarborough Health Network. I know it has been really very difficult for our frontline workers, for all the people working in hospitals, but you have been there day and night to make sure that we are all safe. So a big thank you to all of you from all the residents of Scarborough. And with this, I will pass the floor to you, David, for your remarks, what you are doing at Scarborough Health Network. I think everyone is excited to hear some updates from your end.
Wonderful. Thank you so much, MP Zahid, and thank you so much for having me here today and for hosting this really important town hall. It's really important that we get together, that we have these conversations, that residents and the community members are informed about what's happening at Scarborough Health Network. So for our agenda today, I'm going to talk a little bit about what we're seeing in our community, what SHN is doing, and also talk a little bit about vaccines and the information we have right now with regards to vaccines. Uh, so the first thing is this is sort of what was the most recent map that the Toronto Public Health has with regards to where we see the most number of recent cases. So this is from December 23rd to January 12th. The darker the area it means that there's more COVID cases per 100,000 that we're seeing in that specific place. In Scarborough, all of the testing centers are run by Scarborough Health Network so that we do see this data and we do know where these areas are so that we could focus our teams and our community partner teams to go into those areas and see what kind of supports we could offer to people once they do get their COVID tests, if they are positive, and people that might be susceptible to COVID or live in high risk environments. The one thing that we do know is that COVID-19 has hit Scarborough harder than it's hit a lot of other areas. there are some reasons that we do know that this is the case and why this is the case. One of the reasons is we know that a lot of the folks who live in Scarborough have those essential jobs where they can't work from home or they can't not show up for work. Another reason is we know that a lot of the family makeups in Scarborough is multi-generational households. So that if you do have someone who does become COVID positive, it makes it very hard to isolate from other members of your family. And what we saw in wave one and a little bit in wave two as well here in Scarborough is we do have 20 long-term care homes, and we do all know how susceptible residents and staff in long-term care homes are to COVID-19. So what are we seeing right now? So this is as of Thursday, January 14th. What we know is that about 10% of the total COVID admissions in this province are in Scarborough Health Network. And about 8.3% of the total ICU admissions as of Thursday were in Scarborough Health Network. The numbers that you're seeing on the lower left are just a little bit of our daily dashboard. So I took a snapshot of where we were on Thursday. So as you can see, total COVID is 94. Total COVID off isolation, which means people that are no longer are no longer able to spread COVID-19, but are in the hospitals and have long-lasting effects and still need to be treated because as a result of COVID-19. So those are 72. And 147 are people under investigation, which basically means people in the hospital that need to be isolated until they get a COVID-19 result back. Our assessment center positivity is actually quite high, and that's something that is not really well known because our numbers in terms of test positivity get lumped in with Toronto. And so what that does is it kind of pushes away and negates a lot of the times the high volume and the high numbers in Scarborough, and it actually ups the percentage positivity in the rest of Toronto, which doesn't actually show a clear picture of where the hard hit areas are. And with a population of about 680 to 700,000 in Scarborough, that's a sizable population to have this level of test positivity. We have had conversations with the mayor and Dr. Davila to see how we can work together to get numbers out there for Scarborough so that members of the community and folks know exactly what's going on. What we've done at Scarborough Health Network is we have gone out and we have so far vaccinated all of the 20 long-term care homes that are in Scarborough. We also have vaccinated what are called priority retirement residences, and those priority retirement residents were identified by Toronto Public Health. So let's talk a little bit about vaccinations. So vaccinations have been around for decades. One of the biggest modern advances of modern medicine, vaccines prevent millions of infections every single year. We've eliminated smallpox on the entire planet because of vaccinations. And in 1994, Canada was deemed polio-free due to vaccinations. Now, there are a lot of new vaccinations that become developed and approved by Health Canada. And I have a list there on the right that shows some of the more recent vaccinations that Health Canada has approved. So what do we know about mRNA vaccines? mRNA vaccines are the vaccines for Moderna and Pfizer, which are the two that are available right now. What we know about mRNA vaccines is what they do is they take the spike protein, which is basically a protein, and they do an mRNA sequence of it to get the codes for those spike proteins. They coat the mRNA in a lipid coating, which basically is fats, and that creates the mRNA vaccine. The mRNA vaccine then, when someone gets vaccinated with it, what it is it's different from traditional vaccines in the sense that it's just the spike proteins that come out, and you develop the antibodies for the spike proteins. So mRNA technology has been around for decades. The previous research into using this technology were for influenza, Zika, rabies, and HIV vaccines, but it was stopped due to cost and transportation storage. And as we've seen with Pfizer, it has to be in negative 75 degrees. It's not that stable when it's outside of that area. We only have a couple of hours to use it. So it's not, it's a different vaccine that requires more tender love and care with it. And so far around the world, we've seen 51.9 million doses of vaccines that have been administered in 51 countries. This is as of January 2021. Now, vaccine hesitancy is something that I really want to talk about. And vaccine hesitancy is not the same thing as being an anti-vaxxer or as not believing that any vaccine works. But it's natural that when something new comes on the market and when it's been developed rather quickly, that there's a lot of questions about it. So what does vaccine hesitancy mean? Well, the way that we see it is it's complacency, confidence, and convenience. And I'll talk a little bit about these. So the convenience is, to what extent is the vaccine available, affordable, and accessible? And as MP Zahid said, the vaccine will be free for all Canadians. What we're working on at Scarborough Health Network is we're working with our community partners right now, and that includes University of Toronto Scarborough Campus, Centennial College, Scarborough Center for Healthy Communities, Taibu, Care First, and Malvern Family Recreation Center, so that we have in Scarborough the locations, the logistics, and everything ready, so that when we're ready to hit go and when we're told, all right, now we're moving on to phase 2, phase 3, this is when we're going out and doing mass vaccinations in the community, that we have all the things ready here in Scarborough to get this going as quickly, as equitably, and as well organized as possible. For confidence, it's trust in the effectiveness and safety of vaccines, the system that delivers the vaccines, the motives of those who establish the policies and the necessary vaccines. And that goes to the confidence of you getting the information that you need about the vaccines, and also having trust and faith, like MP Zahid said, in Health Canada to make those right decisions. Now, one thing that I can say about Health Canada is it is notorious around the world as being one of the agencies that it's actually has some of the highest standards for approval of any new drug into Canada. So that is so there's a lot of confidence that I could say from my end in what comes out of Health Canada, knowing the level of scrutiny that they provide to really anything that wants to make its way onto the Canadian market. And then the third one is complacency, which is the perception that the risk of the vaccine, preventable disease, are low and the vaccines are not necessarily preventative. And for this, it's understanding what is the risk to yourself of getting the vaccine, and if it's the bigger risk to yourself of what will happen if you or family members and people around you get COVID. So a little bit about confidence. So what's going to help confidence is to understand about severe adverse events, allergies, what you can do if you're pregnant or breastfeeding, autoimmune disorders, and does the vaccine cause infertility? I'm not a doctor, so I'm not going to be able to go into the details of all of these, but these are things that have been raised as concerns from staff members here at Scarborough Health Network who have been receiving it. And there's a lot of great information online to help you make the decisions that are right for you. Some of those resources, and I'll be able to share this with MP Zahid as well, so that her office will be able to share it with you. But the National Advisory Committee on Immunization, which is a Canadian organization that is very, very reputable, has put out a number of guidance documents for physicians and also for community members and people and Canadians about all of these things. And then there's also the Infectious Disease Society of America, which also has a lot of great information. So a lot of questions that people were asking were about severe allergic reactions. And what we know is severe allergic reactions are rare. It's 11.1 cases of anaphylaxis for 1 million doses given. Out of those people, 82% had a history of allergic reaction and 33% had a history of anaphylaxis. The majority of their allergic reactions happen within 15 minutes. So what's important in the process of when and it's your time to get the vaccine, is the vaccine will be given by a health professional, whether it's a physician, a family doctor, a nurse, and they'll go over all of the things with you and answer any questions that you have. And after you get the vaccine, you will be monitored by these people for 15 minutes afterwards to see if there are any symptoms. For all of the vaccine first doses that we have given, and for a few of the second doses that we have given at Scarborough Health Network to our health professionals and our frontline heroes, we have not seen an adverse reaction or anything or any serious reaction to the vaccines that have been distributed thus far in our area. And this is just an example that I wanted to show you of some of the things that are provided to your healthcare professionals for when they do an allergies and a risk assessment. And this is also stuff that's that you can easily find online as well in those sites that I sent you, where you could see what kind of allergy you have and the recommendations that these institutions have for your type of allergy. Now, the main reasons to get a vaccine are to protect yourself, protect your family, protect your community. And if you're a health professional, if you're a personal support worker, which we know we have about 21,000 health workers and personal support workers in Scarborough, it's to protect your patients as well. Now, I'm on to the part now where I'm more than happy to answer any questions that you might have to the best of my ability, and things that I'm not able to answer, I will get back with an answer to MP Zahid and we will pass it on to you. So with that, I'm more than happy to take your questions.
Thank you, David. It was really very informative, and I hope everyone finds this information good. We actually asked everyone to submit questions. So we have received some questions. I will start with those questions and then we can open to the floor. So we had a number of questions about vaccines, specifically when different groups of people will be able to receive their vaccination. So I just want to highlight a question which has been submitted by Debbie Sude. She asked, I want to understand what is being done to prioritize and accommodate seniors who live at homes in terms of the vaccines. I know that seniors over 80 will be part two of phase two, will be a part of the phase two, but frankly, this is not good enough. They are frightened and vulnerable and need to know their government is looking out for them. So some are severely disabled and don't even know how they will get to a vaccine site. We also had some questions about vaccines from Paul Sampson, Catherine Boyle, Carol Baker, John Dulogos, and they are all asking for more information on when and where people will be vaccinated, especially the seniors who are not living in long-term care. So I will pass the floor to David.
Thank you. So what we do have right now is we know that the priority are to really, when the vaccine supply allows it, to get it to those people. Right now, what our focus is, and again, this changes quite frequently, and I think a lot of it depends on the changing dynamics with where we're seeing hotspot areas, and also this is in terms of the province, but also vaccine supply. Right now, what we're looking at is we really want to get as many of those personal support workers who go from home to home with where those seniors reside, that aren't in retirement residences, that aren't in long-term care homes, that have already been vaccinated, to make sure that that they're vaccinated so that they can protect themselves and that they can protect the patients that they're seeing. From my understanding, there is that there's ongoing planning right now, and that's a lot of the work that I was talking about as well, about what we're doing with our community partners to get ready for that when the time comes that we can give vaccinations to that group of people. Oh, MP Zahid, you're on mute.
Yes. Thank you, David. And now I will go to the next question, which was submitted. And that question is from Mr. Betty. When, how, and what brand of vaccine is forthcoming? So I see Paul Betty on the call also. Paul, Pfizer and Moderna, these are the two vaccines which have already been approved by Health Canada. And right now, Health Canada is reviewing AstraZeneca. They are currently in the process of examining that. And very soon, Johnson and Johnson will be ready for evaluation. So these two are in the pipeline, and as yet, Health Canada has approved Pfizer and Moderna, which are being put in the arms of the people. The next question was submitted by Edith Foreman, and the question is, why is the amount of vaccine being received by Canada so comparatively low? Uh, yes, we all want to see that everyone is vaccinated at a much faster speed, but as I hope all of you will understand, it's a global pandemic. The demand is very high. I think Canada is doing very well if you compare it within the G20 countries and otherwise also. We have entered into agreements with different candidates, and we have the best portfolio of different vaccines. We already have received over 1.1 million vaccines, which has already been distributed to different provinces and territories. Province of Ontario has received over 400,000 doses of both Pfizer and Moderna. We are on track to vaccinate all those Canadians who want to get vaccinated by September. So I think Canada is in a good position, and we are on track. And all those Canadians who want to have a vaccine would be able to get a vaccine free of charge by September. Next question has been submitted by Jillian Mason. This is about the question is, will economic recovery dollars of Government of Canada be invested in Scarborough proportionate to both the needs and the opportunity here? Thank you, Ms. Mason, for your question. And I think you are on the call too. Thanks for joining us today. As soon as we get through this pandemic, robust economic recovery, it would be needed, and Government of Canada would be there to make sure that the needs of all the communities are met. And as soon as we get into the recovery phase, we will make sure that we invest in the needs of all the Canadians, like housing, transit, better infrastructures everywhere, from coast to coast to coast. And as your member of parliament, I will continue advocating to make sure that appropriate number of dollars are invested here in Scarborough. We have a very strong team of six Scarborough MPs who are working very hard on behalf of all the residents of Scarborough. We just last week on Tuesday, we had a robust session with different stakeholders in Scarborough and got their budget submissions. You were also part of that meeting. And we heard from a lot of stakeholders about the needs, and we will be submitting those to our finance minister, Chrystia Freeland, to make sure that the needs and the voice of Scarborough is heard. So we will continue advocating, and we will make sure that we fight for the people of Scarborough and be their voice in Ottawa. Our next question is from Jenny Tang. COVID-19 brings society, isolation, mental health issues, and a lot of people are suffering from that. So what we are doing on that? I know mental health is a big issue, and as since March, we have all been going through this pandemic, forced to stay at our homes. We have seen an increase in the number of mental health issues. For many people, home is not a safe place. And we as a government strongly believe that we need to invest into mental health. The COVID-19 pandemic has not been easy on the Canadians' mental health. We have invested $7.5 million during this pandemic to Kids Help Phone to provide young people with the mental health support they need during these difficult times, because for many young people, home is not a safe place. So I just want to let them know that they can rely on the resources available in the community. They can call Kids Helpline, and we have invested more money into it. One resource which we have worked to launch is the Wellness Together Canada. with the support of the health professionals. And you can go there, and there are resources, there are apps, there are online supports available through that. Over 847,000 individuals all across Canada have accessed this service uh, in 2.49 million distinct web sessions as of January 19th, and they are all completely free. So you can go to the CA portal for the Wellness Together Canada and get more help. Otherwise, as we are all going through difficult times, if we know of our friends or family members who need help, please take care of each other. I think we can only get through this pandemic if we can rely on each other. We should, although we cannot meet personally, but I think we can always check on our friends and family virtually. Now, with a lot of use of technology, we can use our iPads and computers to do some FaceTime, check on how our loved ones are doing. I think it is really very important that you connect with your loved ones, and if they need any help, provide that help. And I have seen here, I'm very proud of the Scarborough community. Community members have come together to lend support to those who need that. uh, our next question is from Preeta Stephen. I don't know if you are joining our, um, if you are on the Zoom, please wave your hand. Your question is about supporting people with disabilities. Uh, During this pandemic, a one-time payment of $600 was sent to people with disabilities just to help them. Uh, Otherwise, if someone has a disability, Ontario Disability Support Program here in Ontario offers help. It is important that we make sure that all the needs of all Canadians are met. So we will always be there to provide help to those people with disabilities. Our next question, which was submitted, is from Ian Marquez. When will the government implement the recommendations of the missing and murdered Indigenous women and girls? Uh, in regards to this missing report, I know inquiry for its, I would like to thank the inquiry for its important and difficult work, and especially all those who are courageously spoke up and relied their pain to share their stories. As Canadians, I think we had to face the heartbreaking reality that we failed the Indigenous women, girls, LGBTQ, and Two Spirit people who disappeared, suffered violence, or were killed, so that many of the same realities that led to these tragedies still exist. We are committed to work on the reconciliation. Many steps have been taken towards that, and we will continue our work to make sure that we provide justice to those people. We recognize there is much more work to be done and are committed to taking concrete actions that will help keep Indigenous women, girls, LGBTQ, and Two Spirit people safe and address this disempowering effects of colonization. So we will continue to work with all Canadians to call out and address the systemic sexism and racism in our society. Uh, Let me just go to the next question. Uh, the next question is from Carl Archibald. I need to ask, what are the possibilities of resuming my former position as a provincial officer with Toronto Community Housing? I see Carl Archibald on the call. Toronto Community Housing is a municipal issue, and you should get in touch with the Toronto Community Housing to check on that. And I think they would be able to provide you more information. Toronto Community Housing doesn't fall under federal jurisdiction. So please be in touch with the people at Toronto Community Housing, and they would be able to guide you through. I have another question from Arnold Augustine. You are concerned about the flights with COVID cases coming in, COVID testing, false positives, and why not masking recommended earlier? Uh, See, this is an evolving situation in regards to masking. When we were hit by the pandemic in the phase one, we didn't had scientific evidence to show that everyone should wear a mask. As we got through this pandemic, there was some more data. We are a government which believes on science, and as the data came in, and we were told that it is advised that we should all wear masks inside. Public health told all Canadians that it is important that you wear a mask inside. Even now, the recommendation from public health is that we should wear a mask even if we are outside and cannot have a 2 meter distance. So, based on the public health advice, I think everyone should follow that. And if you are inside or outside and cannot have a 2 meter distance, please make sure that you wear mask and keep yourself safe and keep your loved ones safe. We have another question from Charlene Kopensky. What does one do when Costco at Ellesmere and Warden and Scotiabank at Lawrence and Birchmount are not following COVID protocols? Uh, the Ontario government last weekend, I think, did some spot checking at many Costco's and Walmarts. Uh, it is the advice of the public health and government of Ontario and as well as city of Toronto that everyone inside should wear a mask. And I also visit on weekly basis Costco at Ellesmere and Warden. I see majority of the people wearing masks, but in case if there is someone who is not wearing a mask, ask one of the staff members there, let them know that this is what you have seen, and they can talk to the customers and their staff members. I'm sure they will take due notice of that and tell their people coming in. Usually I see at the Costco, there are people as you enter, and there are sanitizers also there. There are people who ask you that you should wear a mask. But in case if you find someone, please talk to one of the staff members at any Costco or at the branch of a bank, and I'm sure they would all take appropriate measures. So with this, Jeff, the questions which we had received already are done. I think now we can open the floor, and if there are any questions, we can take it. You can raise your hand.
Sure, we have some in the chat and some
Okay.
in the room. So if you'd like to ask your question, if you can use the raise your hand tool within Zoom or just type it in the chat. And we've had a raised hand for a long time from Juran Mahalingam. So I am going to unmute you and you can ask your question now.
Yes, Majuran.
Yes, can you hear me?
Yes, we can hear you.
I want to first of all say Happy New Year.
Thank you.
You're welcome. So now most people are on welfare disability like ODSP. I just want to know how would I certainly support your government, what you are doing, but I was wondering how they would go into good jobs and keep into the different jobs. So how would they get out of welfare or ODSP and get into jobs? And also for the vaccine, I was wondering who would get the first vaccine and like what age group would get the first vaccine? And will they say this vaccine may trigger seizures for people who have seizures? I was just wondering about that. Yeah.
So maybe first I will ask David if you can answer on the vaccine part, and then I will go to the other part.
Great. So right now, the priority age group for the vaccine is people that are living in long-term care homes or in priority retirement homes where they're most at risk. The group after that, based on the Ontario government, is going to be for at-risk people over the age of 80, I believe. In terms of seizures, I haven't seen anything about that, and I haven't heard anything about that. But what I'll do is I'll just ask our team, and I'll get back to an answer to MP Zahid so that her office will be able to follow up with you.
Okay, thank you, David. Majuran, in regards to your question about people who are on Ontario Works All Welfare, we are right from the beginning, since when we have been hit by the pandemic, we have been investing into Canadians and making sure that help is provided
it's important.
Sorry. We have been there for Canadians. We are those who lost their revenues because of COVID-19. We introduced CERB in the beginning now, which has been changed to CRB. And many other programs are there to help the businesses through the wage subsidy. We will keep on investing in Canadians. And as soon as we are in the recovery phase, we will invest in Canadians. We will invest in housing, transit, other infrastructures, and that will stimulate economy and create jobs. So with that, we will go to our next question.
Okay, we'll go to the chat, and there was a question from Julian. Julian, I see you're in the room. Would you like to unmute? And okay, just give me 1 sec, and I will unmute you.
Sorry, there's more to it than just sitting idle. Thank you very much. Actually, my question did get answered, Jeff. I was interested in jobs for Scarborough people, particularly post-COVID, to ensure an equitable recovery. And I'm confident in what I have heard that it looks like federal government will be paying attention to some of the needs in Scarborough, and also the opportunities also relating to the last question that was asked around jobs for people with disabilities and new Canadians and people who have been out of work for too long. Really helpful if we're able to connect people living in marginalized circumstances to the new jobs that are going to be created through federal government spending. So that was really the pith of my question. Thank you, Jeff. Thank you, MP Salma.
Thank you, Julian, for joining us. And I assure you that we will be a strong voice in Ottawa on behalf of all the people of Scarborough and make sure that Scarborough gets its fair share.
Okay, we had 2 questions in the chat from Kutsia Husseini. Would you like to ask them, or would you rather that we just read them out from the chat?
You can read it out for me, David. Thank you. Sorry, Jeff. Thank you.
Okay, sure. So the two questions were, after we have the vaccine, do we still have to distance and wear masks and stay home? And can we still get COVID? So maybe we'll start with that one. That one might be for David, I think.
Yes, so
Great.
David, we will request you to answer this question.
So what we know right now is when the manufacturers were doing their preliminary rounds of vaccination testing, what they were testing for is to see what they were monitoring is what are the chances that you will have an adverse reaction or that you will get COVID, you yourself, if you have the vaccine. And the results that we know is that the vaccine works to protect you after the second dose to 90, I believe it's 97, 98%. What hasn't been studied so far, and what they're studying right now, is how the vaccine protects other people around you from getting COVID. So until we have an answer to that question, the recommendation is that even if you do still have the vaccine, and when you get the vaccine, that you continue masking, keeping social distance, not so much to protect yourself, but to protect the people around you who haven't been vaccinated. Now, that's the information that we have right now. But as we all know, because so many of these vaccines are being given out around the world and all these people are being monitored right now, that might change in a month or two. But for now, the recommendation is that you still keep following all the guidelines after you get vaccinated.
Thank you, David. And the second question is probably for Salma. It's that she mentions in California, each of the seniors got $1,200, and in Ontario, we got $300. So I guess the question is, will there be more support for the seniors?
Thank you, Kutsia Baji, for this question. During this pandemic, one-time payment to the seniors has been given. So to all those seniors who are on old age security got $300, and all those seniors who are getting GIS also, they got an additional $200. So all those seniors who are either on who are on both old age security and guaranteed income supplement got a supplement one-time payment of $500. In addition to that, during this pandemic, we have invested $20 million into New Horizons for Seniors programs. It's a great program, and many organizations in our riding have got advantage of that to get the seniors out of isolation. So I know many organizations, many stakeholders in our riding got funding through New Horizons for Seniors, and they ran programs, virtual seminars to provide more information to the seniors. They ran programs to allow seniors to rely on someone to get their groceries if they have to pick up some prescriptions from the pharmacies. So that money was invested to make sure that we provide help to the seniors. So, and we will continue fighting for more help for seniors. And we promised in 2019 for an increase in 2019 platform. When we ran, we promised that there will be an increase in old age security and CPP for the survivors for the over the age of 75. So yesterday in our senior caucus, we have been discussing that, and we are putting it as a recommendation to our finance minister. So we will continue advocating on behalf of all the seniors. Jeff, you are on mute.
There we go. Thank you. So next up, Debbie Sudik, would you like to ask your question?
Debbie.
Sure. Thank you. Thank you so much. First of all, I just want to say thank you to Salma for bringing my question forward, but also for getting back to me earlier this week in terms of my concerns regarding seniors. You are the only person within the government that has actually got back to me. So I just want to applaud you for taking the time to actually, have that conversation with me. And my question is really for David. So I don't actually live in Scarborough. I'm on this call as an advocate for my parents who are 92 and 94 and live in their own home, have lived in Scarborough in the same house for 68 years. Both of them are disabled. One has dementia and it has very low mobility. And what I have not heard in terms of the phase 2 for seniors is how these people are going to be accommodated in terms of prioritization to get them to these vaccine sites. So I appreciate the fact that PSWs will, in fact, be prioritized to stop the spread. However, many families, like my own, have chosen not to bring PSWs into our home because it's no different than going into a senior's home at this point in time. PSWs are seeing multiple people throughout the day. And so we've chosen to look after our parents ourselves, despite the fact that there is a stay-at-home order. And I want to make sure that our voices are heard and that my people like my parents and my parents are prioritized in phase 2. And there is some consideration in terms of how they're going to get to these sites.
Great. Thank you so much for that excellent question and those comments, Debbie. I think it's something that that's a frustration that I would expect many people on this call have. And I know that even from my personal side, from my family, it's very similar to what you're saying with regards to my 94-year-old grandmother who does live alone. And we stopped having her personal support workers and the people that she's comfortable with coming over to support her. And it is very difficult. And so what I'm going to take away from this is I don't know what our plan is right now about how we're going to make the vaccines in Scarborough accessible to seniors who do live on their own. I will take that back to Glyn Botswain, who is our chief nursing executive and the person that's leading the logistical and the planning for when we're ready to do that. And I will make sure that we do have a plan for that. I don't know if it's being worked on already, but it is something that I will follow up with Glyn today. I do have a conversation with her later. So thank you for that. I think it's very important that we do find a way to make the, like we said in the presentation, they have to be accessible or people aren't going to get them. So that's very important. So thank you for that.
Thank you, David. I'm told that Carol was waving her hand, but I see she's on the phone now, so maybe we'll come back to her. Carl, I see you waving your hand. I'm going to unmute you now, and you can unmute yourself.
Hi, can you hear me?
Yes.
Okay, good afternoon,
Good afternoon.
Salma. Good afternoon, David. Happy New Year, all the best. You mentioned about my former position at Toronto Community Housing, and I wanted you to know that it's a little bit deeper than that because it involves former Police Chief Bill Blair, former director of Toronto Community Housing, Terry Skelton. So I wanted to have maybe a one-on-one talk with you about that, and we could probably go into that at that time. However, just one quick question, David. What or is there any specific numbers to call that I could find out where any of the COVID test centers are in and around Scarborough? I know that. Sorry, go ahead.
Thank you, Carl. And in regards, if you want to have some discussion one-to-one, please send an email or call my office and leave a voicemail. And then one of my staff members will be in touch with you to set up that.
Okay, thank you.
I will pass it on to David for the other part.
Yeah, David. So are there any numbers to call to find out where the COVID test centers are in the Scarborough area?
Thanks for that excellent question. So yeah, so I'm gonna look for the number specifically, but I know that it's, if you go to www.shn.ca, and I think it's /COVID. Oh no, just shn.ca, and there's a COVID section on there where you could find a list of our, okay, well, shn.ca is, oh, there we go, didn't do all 3 WWs. Where you can, so on the top left, it says COVID-19 information, and on there is all of the information about all of our assessment centers, and you can book online for an assessment center at U of T or CICS, or we also do weekly pop-ups at 3 locations in Scarborough, and those information is on there as well. But I'm just looking for a call information of where you can call if you have any questions. And I'm just having some trouble finding that piece, but as soon as I find the phone number, I will send it to you. But I'll put the website for now into the chat function.
Thank you, David. Carol was raising the hand. Carol, you can unmute yourself and ask the question.
Just one second. I will have to do something on my end to allow her to do that. Okay, you should be able to unmute now, Carol.
Okay. Hi. Thank you for this wonderful session. I heard about phase 2 for those at risk 80 years old. I was just wondering, because we do have a seniors association with 65 and above, and they're already asking me when is the possibility of when these seniors are going to be vaccinated. Although we are a healthy seniors association, our members are also at risk because they do have some comorbidities like diabetes, hypertension. Some of them are also cancer patients, received chemotherapies and radiation. So my question is, I know that you have phase 2. Do we have a phase 3?
So David.
Yeah, so the province does, the province has put out the different phases that they have for this going, I believe, all the way up to the summer. And I just, not off the top of my head, I couldn't give you an answer as to where specifically though that group falls within which phases. But I know that that information is on the Ontario government COVID-19 website with regards to the different phases of where people are in. I think a lot of it really does depend on when we receive the doses and when we're able to get out there, and it's sort of like an accordion, sort of like you can make it as wide and as quick or as short as possible. But I think the important thing for us right now is that we need to make sure from Scarborough Health Network and from our community partners that when we do get those vaccine doses, that there's no lag time, that there's no 2-3 weeks after that when we have to start, putting the things in together and implementing before we could get it into the arms. The priority for us right now is to make sure that the second those vaccines come in, that we are able to get them into arms as quickly as possible so that in Scarborough, we're able to move through the priority phases as quickly as possible.
Thank you, David.
We have a raised hand from Clinton Somerville. Would you like to ask your question now? You can unmute yourself.
Yes. Hi, can you hear me?
Hi.
Yeah.
Yes.
Yes. My name is Clinton. I'm a PSW. I work I don't work in a nursing home or a hospital, but I work in a self-directed care. It's basically a building with units dedicated to the physically disabled that live in their own homes, their own apartments, and direct their own care. They're not necessarily seniors. In fact, most of them are younger people. So we work within the same one building, so we don't go to different sites. And we work 24/7 with these clients. But we haven't heard when we will be getting our vaccines, since we're basically frontline workers with the clients.
So maybe we will ask David to provide some information on that if you have.
So what I know about PSWs, which are personal support workers, and that's a great question, is that we are currently in the process of being provided a list from the LIN of the personal support workers that are in Scarborough. My understanding is that list is a comprehensive list of all PSWs in Scarborough, and it's not broken out based on which places you work in, because PSWs are considered to be high risk where they're going in. So my assumption, and again, I don't know this for sure, but my assumption is that the PSWs will start getting contacted rather shortly with regards to this, if it hasn't happened already. But I do know that that the PSWs are what is being PSWs and the remaining long-term care homes are what's being focused on right now.
Thank you. I'm going to go to the chat now. Maybe I will just read out two to speed things along. So a question from Samina Work asking for people who are on EI because of the pandemic and it's not enough, is there additional support? And a question from Sharia asking about are there opportunities to volunteer in the office?
In regards to the opportunities to volunteer in the office, right now the office is closed, and myself and the team, we are working from home. So once we are in better days and we open the office, of course, there are a lot of opportunities. We do a lot of community events and things at the office. So once we are open, please be in touch with us. But if you need to volunteer now, you can go to some other organizations. Especially I have seen the food banks in our riding are under a lot of pressure because of higher demand. So you can be in touch with Dorset Park Community Hub or Grace Place or there are 4 or 5 food banks in the riding, and maybe Nestor can post them in the chat. So please be in touch with those. All those individuals who either have lost their job because of pandemic, or they have lost a substantial part like hours because of this pandemic, they cannot work. And those who don't qualify for EI, we have changed the CERB to CRB, Canada Recovery Benefit. And if your income is lost and you earned and you qualify for that, you can get that for at least 26 weeks. So that help is there. We have reformed EI measures also to make sure that more help is there. So, and in addition to that, we are providing relief to those families who get Canada Child Benefit, additional $1,200 during this year in the form of $300 one-time payments over the year to help the families navigate through this pandemic.
Thank you. We have a question from Pastor McGann. You should be able to unmute yourself now.
Hello, Salma. Thank you.
Hi, Pastor. How are you?
Not bad. How are you? Thank you for taking the time for this very important session. You have shown over the year that you are more proactive than any MPs I've ever seen. So thank you very much. So the question I have is in regards to food bank, which we run at our church as an extension of our church, and the staff and the volunteers. We have about a dozen staff and volunteers. When are they in line for vaccination if they are considered in the lineup in phase 1 or phase 2?
Thank you, Pastor, and thanks for the work which you do in this community. Pastor Melvin McGann is from Meadowville East Apostolic Church, and they run a food bank also, so they have been there for the community right from the beginning. So I will pass it on to David for the answer.
I unfortunately I don't know when that will happen. It sounds that if the volunteers fall within priority groups of certain age groups with pre-existing conditions, then presumably they will be earlier in line for the vaccine. But I truly don't think that that the planning has gone that far.
Hey, you are on mute, Pastor.
I'm sorry, it's not the answer you were looking for.
Oh, thanks, David. But a number of our volunteers are seniors,
yeah,
and they have acute conditions, and so and we have some younger people. But who can I reach out to see where the schedule is for these group of people?
So I don't think that resource exists, because I don't think that the answer is known to that.
Okay.
Yeah, when it will be known, and when more information will be out, when we have more information about general public and people that don't live in, like we're talking right now, the stages where we are right now is people in long-term care homes, in retirement homes, in those congregate care settings. I personally haven't seen what it will look like after that phase. I know that they're probably planning for it right now. It just hasn't been communicated.
Okay. Well, I guess we'll wait. Thank you.
Thank you. Is there anyone that has not asked a question yet? That would I see Dina. Just give me 1 second. Oops. Okay, you should be able to unmute now.
Thank you. First of all, thank you. Yeah, hi. Happy New Year to everybody. Thank you so much, Salma, for arranging this meeting. And thank you so much for being so accessible all the time and be concentrating about our needs. I have a question regarding immigration, regarding the refugees resettlement to Canada. We are sponsoring refugees from overseas. I know some of the refugees whose visa was already issued before March, and they're travel ready, they're ready, but because of the restriction on flight, so they couldn't take their flight. Especially some refugees in Iran, like there are some families that they were scheduled to arrive on 27th of February, and they actually gave up their house and households and everything. They were ready to come, but their flight was canceled. They didn't hear back when they will be rescheduled. Since then, they are still living in temporary accommodations. And this creates a huge risk for the refugees, especially this is that women almost at risk. And also for the organizations who are sponsoring, because we don't receive the money or support from anywhere. We arrange the house and we arrange the all the measures for quarantine and all. And we are waiting in limbo. We don't know what happened. There were some flights from Iran, I think, but that's like some Canadians and others arrived, but those refugees were not put on flight. We kept on requesting, like continuously we requested if they are put on the flight, they were not put. So I'm just wondering when the refugees who have the sponsors here, privately sponsored refugees, when their cases will be processed and when they'll come here.
Thank you, Adina Niazi, for this important question, and thanks for the work which you do. Adina is part of Afghan Women Organization, and they are doing very important work in the community of Scarborough as well as Don Valley. Immigration is a very important issue, and I totally understand that there have been a lot of delays because of this pandemic, because of the travel bans, not just here in Canada, but across the world, which we saw as soon as we were hit by with the wave 1 of this pandemic. Those individual families, or like those cases where the lending paper expired because they were not able to travel to Canada because of the travel ban. And now I know the IRCC is working on issuing them the new documentation. So if there is any particular case in regards to that, and because all cases are different, so please forward that information to our office, and we would be gladly we would look into those cases and see what help can be provided to make sure that their cases are expedited. There have been a lot of delays, but IRCC has now put in a lot of more resources into the immigration department to make sure that we can get through the backlog which we have developed. And in regards to the spousal applications also, the minister announced that they have hired more staff to look into the files and make sure that the cases are done urgently. But like many VAC offices are closed. I know a lot of issues are happening where the applications are going through London office because that's totally closed. Individual cases, we would be happy to look into it, but I assure you that the department is looking into to make sure, and they are putting more resources to make sure that they can clear the backlog as soon as possible. Thank you. Linda was raising the hand, Linda Hopkins. So Jeff, if you can unmute
Linda.
Linda.
You should be able to unmute yourself.
Hi.
Hi, Linda.
Question for David. Those health workers who are in private practice, PSW, RN, like they're not on anybody's list because they work independently employed, basically. How do they find themselves getting onto a list?
So I can get back to you on that, but my understanding is that the Local Health Integration Network, the LIN, as it's called, they should actually have all public and private, but I don't have an answer to that question right now. That's my understanding.
No, if you're self-employed, you're not on anybody's LIN list.
Okay, so what I'll do is I will I'll follow up on that with Glenn, and I'll get back to MP Zahid with that answer.
Thank you. Also a comment regarding getting people who are at home and unable to get out for the vaccines. One thing I would suggest to Salma is that the faith group leaders that you have, that group would be a good contact because people in our congregations, we know who those people are, and we can easily make those lists and to some extent facilitate getting them onto the idea of being vaccinated.
Okay, thank you, Linda. Like David, would you like to add to it something, or?
To the last part, I would just say I think it's going to be very important when we do start doing mass vaccinations that it's an all community effort. Like you were saying, I think that we're going to have to reach out to work with faith groups, with community associations, with civil society to find these people that do need the support, and to create the systems to give them the support and to help them get their vaccines, whether it's through education, whether it's through getting, actually physically helping them get to the area where they have to get vaccinated. I think it's going to be an all of Scarborough effort to do this properly and to get it out. But from what we've seen so far, and even the feedback on this call, is that there's no shortage of organizations and of people that really want to do everything they can to protect themselves and their neighbors. So I have a lot of confidence that once we identify what some of these problems and some of these issues are, that we're going to be able to cooperate and find the solutions.
Thank you, David. And Linda, in regards to your question about help from the multi-faith, definitely when we are at that stage where there will be mass vaccinations, whatever help we can provide through Scarborough Central Multi-Faith Council, we will do. If we need to communicate with the Scarborough Health Network, we will definitely be there to provide help to educate the communities and to make sure to highlight the vulnerable people in our communities.
Thank you. So we are almost out of time, and we have two raised hands, one by Paul and one by Chiranjeevi. So maybe we'll just go to each of them in turn, and if you could make your questions as succinct as possible, and then we'll get the answers for you. So I'll start with Paul. You should be able to unmute yourself now.
Are we good to go?
Yes, we can hear you.
Okay, my question is, if I go to get the vaccine, is there any pre-testing done so the person standing next to me is tested positive? And will that affect me getting my vaccine?
Okay, that's
Thank you, Paul. We will go to the next question.
Chiranjeevi, you should be able to unmute yourself now, sir.
Thank you, Jeb. Hi, Salma. Good afternoon, and thank you, David, for all the insightful information regarding the COVID vaccine. And I'm just sharing, you guys, I already completed my second dose of vaccine on January 7th. It's the Pfizer, and I did not develop any kind of symptoms. A little bit pain on my injection site, so I didn't get any other symptoms. And still, I'm following all the precaution that the normal person who did not get the vaccine is doing. Because I might be the carrier, it won't hurt me, but I might transfer to the other person. So that's why, so it's all the mask, social distance and isolation, everything is mandatory. So my question, I'm working for the one organization called NRNA Canada, and Salma knows about it, and I'll talk about it in our next conversation, next town hall meeting. My one question to Salma is like, we have the visitors and they don't have any insurance, and due to COVID, if they have to hospitalize, it was been said before that because of the COVID, if someone is hospitalized, and all the hospital bill will be, like paid by the Ontario government. What is the policy regarding that topic, Salma? That's my only question for today.
Thank you. In regards to your question, I think that's a decision which is done by the province of Ontario. I can find some more information on that and then get back to you, or maybe in regards to your last part of question, I think it would be best if you can be in touch with your provincial member of parliament, and they would be in a better position because this falls under provincial jurisdiction. Federally, our responsibility is in regards to the transfer of payments to the provinces. And now in regards to vaccination, it is important that we make sure that we have enough vaccines for everyone in the province. But these decisions in regards to who is eligible, not eligible, are made by the province. And I will pass to David for the other part of the question, and the question from Paul.
Great, thank you so much. So I with regards to the question about non-insurance in payment, I actually don't know the answer to that question. So I'll find out and I'll get the answer to MP Zahid as well. With regards to the question about, and if I understood it correctly, are people getting tested before, are people getting COVID tests before they're getting the COVID vaccine? The short answer to that is no. What we are looking at, and the advice currently from Pfizer and from CDC and I believe Health Canada is that if you have tested positive for COVID-19, that you should wait. I believe it's 2 weeks or a month. I can't recall which one it is, so please don't quote me on it. But you, after recovery, to get the vaccination. But all that information should be able to be found on Health Canada's website. But it's another thing. I'll get confirmation what it is. So it's either 2 weeks or a month, but I'll find out for sure.
Thank you, David. And so we will end now, but in any one of you have any questions, please feel free to email it to us or call and leave a voicemail at our constituency office. We are always there to serve you. We cannot have meetings in person, but I've been having a lot of phone call meetings as well as Zoom meetings. So if you or any of your community members you hear from or talk to would like to have some discussion with me, please feel free to get in touch with our office. I really want to thank you all for joining us today. And on behalf of all of you and on behalf of all the residents of Scarborough Center, I really want to thank David for being here to answer some important questions and provide us some insights into the rollout of the vaccines and what they are doing at Scarborough Health Network to make sure that we are all safe. So big thank you to you, David. Please, on behalf of everyone here, we really want to wish you all the best, and please pass it on to the team at Scarborough Health Network. A big thank you for all the work which they are doing. Although the vaccines are being rolled out and we see light at the end of the tunnel, but we are not out of this pandemic. We need to make sure that we continue following public health advice. So please wear your mask, wash your hands, try to stay at home as much as possible. Just go out of the home if you want to buy some groceries or have to pick some prescription from the pharmacies. Spend some time with your loved ones. I think during this last 1 year, that's something positive which I have seen out of this pandemic, spending time with my husband and with my 2 sons, which I, in the last 5 years, didn't get the opportunity to do much and do some cooking. So try to find few other things to do at home and make this lockdown more enjoyable. So we as a family do a lot of cooking, a lot of discussions on different topics of interest. So, and that's how we pass the time. So wish you all the best. I hope and pray that 2021 will be a better year for all of us. We will end this with some slideshow of the pictures which Nestor from my office has developed on how we have been spending year 2020. So that will give you some sneak peek into what I have been doing during this pandemic. So over to you, Nestor. Share your screen, Nestor.
Seasonal allergies, my neighbors are afraid of me and my runny nose. But even if it's Armageddon, everyone still needs a friend, and now we got technology to say hello from my basement, hello from my living room, hello from my balcony, counting up the tumbleweed. Hello from these 4 walls that separate us all, and honey, here's to looking further down the road, to holding hands and never letting go. some groceries, but they didn't have a thing I need in stock. No, not in stock. So I guess I live on frozen peas and vitamins and American whiskey on the rise. And when the zombie hordes come by to eat our brains like apple pie, just hit me up on FaceTime and I'll say hello from my basement. Hello from my living room. Hello from my balcony. And counting up the tumbleweed. Hello from these four walls that separate us all. And honey, here's to looking further down the road. To holding hands and never let go. To more than just hello. No, I can't wait for long cuts. Using all my fingers when I fix my makeup. Dance clubs and dance halls. Eating out at restaurants. Hello from my basement. Hello from my living room. Hello from isolation. Hello from my balcony. Hello from my counting up the tumbleweed. Hello from Brazil. Hello from these four walls that separate us all. And honey, here's to looking further down the road. Hello from Young and Shepherd. Hello. From Santa Maria, California. My in-laws' kitchen. Hello from my kitchen. Gibson. Hello from my living room amid my 20504 Ontario. Hello from the couch. Hello from the comfort of my house. Hi, I'm beneath my sheets with menstrual cramps. Saga. Just I didn't tuck that in here in the bed.
Hello, this is Doug von Kitchener. Hello from out appreciate all your music. Music.
Hello from the sidewalk. Hello from my office. My personal office, where I just started my day by changing it.
Thank you, everyone. Have a great weekend.
Have a nice weekend. Bye. Bye, Jasmine.